What is PRP? PRP is platelet-rich plasma therapy. Although an emerging technology and technique in medicine, it has been used since the mid-1990s in dental and oral surgery and to aid in soft tissue recovery following plastic surgery. How is PRP administered? PRP therapy, which takes approximately 20 minutes to complete, begins with the collection of 30 millimeters of the patient's blood. The blood sample is placed in a centrifuge to separate the platelet-rich plasma from the other components of whole blood. Doctors then inject the concentrated platelets, which are referred to as liquid gold, into the site of the injury. In our office, we use fluoroscopic guidance for accuracy. The platelets function as natural reservoir for growth factors that are essential to repair injured tissue. The growth factors that the platelets secrete stimulate tissue recovery by increasing collagen production, enhancing stem cell proliferation, and removing scar tissue. These growth factors also stimulate blood flow and cause cartilage to become more firm and resilient. PRP activates a healing response to repair injured tendons, ligaments, cartilage, and muscles. Will I feel immediate results from PRP therapy? You may or may not feel a slight increase in pain in the days immediately following the injection. If there is discomfort, it becomes less each day as functional mobility and general functional ability increase along with endurance and strength. You'll notice even greater improvement 2 to 6 weeks after PRP therapy. Some patients report ongoing improvement 6 to 9 months after PRP therapy is administered. In many studies, ultrasound and MRI images have shown definitive tissue repair has occurred after PRP therapy, supporting the proof of the healing process. By treating injured tissues before the damage progresses, surgical intervention may be avoided. Which injuries are usually treated with PRP therapy? Injuries treated with PRP therapy include rotator cuff, quadriceps, hamstrings, Achilles tendon injuries, tennis elbow, knee injuries, thumbs, plantar fasciitis, back issues, and wrist injuries. Essentially, any tendon or ligament injury except complete tears may be treated successfully with PRP. PRP therapy is exactly the treatment needed to reduce the downtime of an athlete or individual while also reducing the chance for re-injury or perhaps the risk of a more serious injury that will result in surgical intervention or permanent disability. PRP is also successful in helping alleviate osteoarthritis pain. Is PRP therapy a substitute for surgery, and why does it work? While many chronic conditions may respond to PRP therapy, making the need for surgical procedures unnecessary, it's impossible to predict if it will work every time. A chronic, incompletely healed condition is characterized by excessive scar tissue within the tendon or ligament. This may lead to impaired joint function or leave the tendon or ligament susceptible to re-injury or complete disruption. This inferior, or in some cases incomplete healing process is due to poor blood supply to the injury site. Most tendons have a poor blood supply and often are the site of microscopic tears or chronic scarring. The body naturally has a difficult time healing these structures. So PRP is thought to initiate a response that makes the chronic condition appear to be a new injury and thus provoke a new, renewed healing response. This new healing response is then augmented by the super concentrated healing factors contained within the PRP. Therefore, with PRP therapy, in combination with the appropriate reconditioning, we can greatly improve the chance of healing and diminish the opportunity for any escalation of the injury. It works the same way for skin and hair rejuvenation. As platelets create new growth cells and stimulate collagen in the treated area, PRP cosmetic treatments are able to restore luminosity and a youthful texture to your skin. When injected into your skin, PRP activates your body's production of collagen and elastin, reviving the skin of your face, eyes, and neck. Is PRP covered by insurance? Although there are tens of thousands of testimonials, there is no randomized double-blind study showing the efficacy of PRP therapy. For this reason, most insurance companies will not pay for PRP treatment. Which conditions can PRP therapy successfully treat? Conditions that can be treated successfully with PRP therapy include the knee, involving osteoarthritis, patellar tendonitis, partially torn or strained major knee ligaments like the LCL, MCL. The shoulder, involving rotator cuff tendonitis, impingement, bursitis, and bicipital tendonitis. In the wrist and hand, involving de Quervain's tenosynovitis, tendonitis, ligament tears. In the elbow, involving tennis elbow and golfer's elbow. The hip, involving iliotibial band tendonitis, iliopsoas tendonitis, and bursitis. Greater trochanteric bursitis, sacroiliac joint dysfunction. In the ankle and foot, involving Achilles tendonitis, peroneal tendonitis, recurrent ankle sprains, and other foot or ankle tendonitis. Neck and back, involving facet joint arthritis, rib problems. PRP is very effective for incomplete chronic degeneration and tears of extra-articular ligaments and tendons. PRP has also been used effectively for hair restoration and removal of fine lines in the face and lips. Are PRP treatments safe? Since PRP treatments are created using your own blood, there's no chance of allergic or foreign body reaction, making PRP very safe. So if you have an injury that isn't healing or chronic pain that won't go away, PRP may be the right option for you.